For a century, cancer treatment meant attacking the cancer directly, cut it out, burn it with radiation, poison it with chemotherapy. Immunotherapy is a completely different idea. Instead of attacking the cancer, you unleash the patient's own immune system to do it. It has produced some of the most astonishing results in all of medicine, and it earned a Nobel Prize. Let's understand how it actually works. To understand immunotherapy, you first have to understand why the immune system lets cancer grow in the first place. Your immune system is a superb hunter of anything foreign, viruses, bacteria, infected cells. But cancer is a tricky enemy, because it isn't foreign. It's your own cells, gone wrong, so it looks a lot like normal tissue, and the immune system hesitates to attack it. And cancer doesn't just hide passively, it fights back. Tumors learn to send out molecular signals that actively switch off any immune cells that come close, essentially flashing a fake "do not attack" badge. So the problem isn't that the immune system can't kill cancer. It's that cancer has learned to talk it out of doing so. That insight led to the first big breakthrough: checkpoint inhibitors. Immune cells come with built-in safety switches called checkpoints, off switches that normally exist to stop the immune system from attacking your own healthy tissue. They're the brakes that prevent autoimmune disease. The discovery that won the Nobel Prize was that cancers hijack those very brakes. They press the immune system's off switch to protect themselves. So the drug idea is elegant. Checkpoint inhibitors block the off switch, they release the brakes, freeing the immune system to see the cancer for what it is and attack it. Note what this means: the drug doesn't touch the cancer at all. It just takes the muzzle off the immune system. And in cancers like melanoma and lung, that alone can produce lasting remissions. The second breakthrough goes even further: it doesn't just free the immune system, it rebuilds it. CAR T-cell therapy is one of the most futuristic treatments in medicine. Doctors collect a patient's own T-cells, the immune system's assassins, from their blood. In the lab, those cells are genetically reprogrammed, given a new molecular receptor that lets them recognize a specific marker on the patient's cancer. They're multiplied into the hundreds of millions, and then infused back into the patient as a living drug that circulates, hunts, and kills. For certain blood cancers, some leukemias, lymphomas, and myeloma, where every standard treatment had failed, CAR T-cells have driven patients into complete, lasting remission. It's a genuinely personalized therapy. The treatment is made from the patient's own cells. As remarkable as this is, honesty requires the limits. Immunotherapy is not a universal cure. For many patients, checkpoint inhibitors simply don't work, and we still can't fully predict in advance who will respond and who won't, a huge open research question. There's a real cost, too. When you release the immune system's brakes, it can start attacking healthy organs, causing serious inflammatory side effects that need careful management. And CAR T-cell therapy, for all its power, has so far mostly conquered blood cancers. Getting it to work against solid tumors like lung or pancreatic cancer has proven genuinely difficult, and it's one of the biggest goals in the field. This is a revolution in progress, not a finished one. The takeaway is that in barely more than a decade, immunotherapy has become a fourth pillar of cancer treatment, standing alongside surgery, radiation, and chemotherapy, and for some cancers it's now a first choice, not a last resort. Its signature gift is durability. Chemotherapy might shrink an advanced cancer for months. Immunotherapy, when it works, can hold it back for years, and a fraction of patients appear to be functionally cured of diseases that were once rapidly fatal. The frontier now is extending that success, to more patients, and to the solid tumors that have resisted it. It's the treatment story most likely to define the next decade of oncology. This is educational, not medical advice.